Is Dean Mazzarola, Mayor for the City of Leominster. Thank you for joining us. It is the 24th of March and about 5 minutes past the hour of 4, and this is the afternoon update. We want to sort of bring you any information that is available to you locally. And so I know there are a number of press conferences. We've been on a number of conference calls throughout the day. In fact, our staff at City Hall is on one as we speak. So let's get right to our slides here because I think that they're helpful. Also, if you have your camera ready or a phone and you see something that you think is important, take a quick picture on it. If not, all this information is available to you by going to our either Leominster.tv or my Facebook page. Also, this is being covered by local radio station 95.1, which is WLPZ. WLPZ broadcasts this streaming as they do all of their programming at WLPZ.org, and then you just click on streaming. Important phone numbers. I'll go through this quickly, but again, take a picture of it now, or you can copy it and screen save it later. 978-534-7500, extension 0, but the number at Emergency Management, where our Emergency Operations Center is 978-534-7500, extension 5055. Meals on Wheels for the Senior Center. MART is operating as of tomorrow. We'll be limiting Council on Aging rides to people that are going to grocery stores, medical appointments, and pharmacies. Call ahead to the Senior Center. They will not be charging right up until April 7th. So if that's an issue, by all means, don't worry about the fee. Just call in as early as you possibly can to get something scheduled. If you have a question, you could post on my Facebook, and I will try to get you an answer. The bulk of today has been with businesses calling and verifying and giving us the necessary information that we need to know that they are, in fact, essential businesses producing product that is necessary in servicing those customers who are either in the medical world or military. So, and then the other half of the day is people that work for various companies wanting to know why they have to go to work. So we are asking businesses that are allowed to stay open to inform their employees as to exactly why it is that they are being allowed to open. Some of it is a federal status, some is a state, and some of it is local. We have a lot of manufacturers here in the city, a lot of companies that supply the medical industry, and therefore they need to continue operation. If you go to City Hall or any municipal building, you can't get a phone call in or you can't get a form online. Most of what we do in city government now is available. However, if it isn't and you get to City Hall, there's a list of phone numbers on every municipal building with extensions. School department continues to deliver food to students who cannot get to one of these other locations. Here are the locations at the bottom of your screen. This is school breakfast and lunch pickup, 7 to 9 o'clock, Johnny Appleseed School, Francis Drake, Leominster High School, and Fallbrook School. Just still on the conference call with United Way, they're launching Stand United COVID-19 Fund. This is a fund where you can make a donation to help others, and also those that are in need can get assistance. So we'll get you more information on that. Some of it is grants, and again, they've had some good success raising funding, and they are also partnering with the Department of Public Health. And again, don't forget that important phone number for the state is 211 for information. And earlier today, the governor talked about a new app that you can download off of your phone. They will not overwhelm you with information, but they will do a couple of posts per day. Funds will take, from the United Way, will take place in 2 phases. First is what's happening now, which is they're going to try to support those local food pantries and programs that offer general support. Second phase is going to be a worker relief program to provide stipends to displaced workers. Stipends will be used for direct payments to vendors. This phase should be active in less than 2 weeks. More details on how to apply coming soon. Updates from the governor. Testing in Massachusetts has drastically increased to 9,000 people per day. And that's going to go up each day. And as you know, Reliant, and I'll give that information in a minute, but Reliant will be going online tomorrow. 10 additional labs are up and running, so the tests are coming back quicker. The tests we do will definitely increase the cases of those that test positive in Leominster. As of this very moment, we have 2 who tested positive. 89 deliveries of supplies have been distributed in the state. 750,000 masks, face shields, and gloves are among those items. This is the new service that I talked about a minute ago. This is an app. It's called COVID Mass, and you can go to 888-777 to sign up for all updates from the state. Legislation is also being passed for a number of different areas. So if there's somebody from New Hampshire who's licensed in New Hampshire to be a nurse or a physician, and they can assist us here because the cases aren't as high in New Hampshire, then they're going to pass legislation that will really do those commonsensical kinds of things. If you can practice in New Hampshire, there should be no reason why you can't practice in Massachusetts. On another note, on the area of education, and I spoke with the superintendent, they're doing a great job at the school department, and the teachers are going above and beyond to stay connected. But what I asked her is to start looking at various platforms, which they're in the planning mode anyway. And if we need to get into that, this ends up extending out beyond what the governor has projected. We really need to start building a support system for students, and especially those in special needs. So the school department is currently evaluating all of that, is getting prepared so that we can start to offer somewhat of a regular school day electronically and over using many different platforms to do that. But the governor, lieutenant governor today talked about giving more school districts more flexibility, extending the deadline for complying with Student Opportunity Act, guidance on graduation, modifications on the MCAS, and much more than that. They're also giving us more flexibility in terms of making those decisions locally on what makes sense for each community. So those things will be helpful. I'll go to my next slide because they're in the area of public safety. They're looking at proposed legislation that would allow retirees to work to fill in gap if emergency personnel become ill. Search warrants can accept electronic signatures from authorities. On the business end, consideration of takeout restaurants in New Hampshire right now, you can go to a takeout restaurant, and also if you got a bottle of wine or something and it was in a sealed container, you could also purchase from them. That would help local takeout restaurants that are really being devastated by all of this. So anyway, a whole lot being proposed, and we'll keep you up to date as things change. And that's why I say the reason we do these updates is to share with you how this affects you locally when you open your front door. Catholic Charities, hours will be Monday, Tuesday, Thursday, and Friday, 8:30 to 4:30 by appointment. There's the phone number. Current services being provided: food pantry, hygiene, pet pantry, diapers, wipes, depends, and case management. Case management will be done over the phone by appointment, and that will need assistance with the SNAP program. If you're a new client, a short intake will be done over the telephone. At the moment, they are not accepting any clothing donations, and the clothing area is closed until further notice. You can reach them, go to their website. Like anything else, hard to get through on the phone sometimes, but you can try www.ccworc.org. We'll put you in touch with Catholic Charities. As you can see, everybody is trying to help out in the best way that they possibly can. Businesses that can stay open, here's the list. If you'd like to take a picture of it, I will not read it. Again, all of this is on our website and Facebook pages. And I'll give you another one there. Again, a lot of our day today was spent on talking to businesses and how, what exactly it is that their business is doing and how it affects the crisis that we're in and the pandemic that we're in as we speak. Just about 5 or 10 minutes left here, so if you have any questions, you can post them on my Facebook page, and I will not read your name, but I will read the question and try to get you an answer. For business assistance, there are a number of areas here for business assistance. I will tell you this, Chamber of Commerce has done a great job of building their website and putting everything that you could ever imagine on that website and all the different links that if you're a business, you will need to know. So go to the North Central Mass Chamber of Commerce website. I'll go quickly. Department of Public Works, sewer treatment plants all over the state are really beginning to, well, I guess it's the fact that more and more people are home. With the disposal of paper towels, napkins, wet wipes, baby wipes, and facial tissues, all of these things are clogging up our filters and our processes at the treatment plant. Trash removal, any chance we can leave more bags? Good question. I'll get you an answer to that tomorrow. I know that more and more people are going to be home. They're probably doing a lot more cleaning because people are pretty much staying in place and staying home. But that's a good question. I will definitely get you an answer. The Are You OK program for those that might be disabled or seniors. Dispatchers at the police department will every day call at a certain designated time. If nobody answers after 2 times, they will send an officer to check in on them. To sign up, you can call 978-534-7560, extension 3432. Let's get back to the testing sites. Leominster Health Alliance, if you go through the front entrance, you will see some signs immediately directing you to the location. They are 5 days a week, Monday through Friday, 10 to 2. From what I hear, the latest update was everything is moving along very orderly. Everyone is respectful and patient, but you must have a doctor's note. You must call this phone number that's here, 978-466-2627 first, so they know you're coming and they can look out for you. And this, again, as you go through the front of the building, the front entrance of the hospital, which is across from Longhorn, you're going to see some signs that are there. It's going to direct you right over there, and everything's moving efficiently. The great part is, as the governor said today, they're doing over 10,000 tests a day, and because there are so many labs available, they are turning the results back to the hospital and physicians faster than ever. And there was one in question that our public safety officers ran into the other day, and with less than 24 hours, we had the results. And luckily, it turned out that it was not a positive case, so that's a good thing. Over at Reliant, starting tomorrow, the 25th, you contact Reliant directly for an appointment, and you do have to be a customer of Reliant to receive a test. Employee business assistance. At City Hall, Melissa Tasker at 978-534-7500, 3579. Chamber of Commerce, northcentralmass.com. Reminder that the Chamber of Commerce has a loan program for up to $20,000. And if you go to their website, you can find out everything you need to know about that, and I think you'll find it extremely helpful. On the federal level, we're working with a number of different companies just in this area, but in the state of Massachusetts as well as other parts of the state. I was on the phone with a flag manufacturer out in Chicago, and they are making masks and face masks as we speak. So they've shut down production on flags. They have all the sewing operations, and so that is really kicking into gear, and I think the supplies are moving faster than we've seen them in the past. This week at the state level, again, more and more materials are coming through, working on a stimulus package for businesses, continuing to expand telehealth so we can get right into the elderly person's home, talk to them about what their symptoms are, and I think that is a huge improvement than taking them out to an emergency room or an urgent care center where they really have, where their chances of getting ill in another capacity as well as the virus is increased. This week on the local level, again, the United Way, all city buildings are closed. However, we are now half staffing, which means instead of every day having full staff, we will do every other day. The purpose of this is a number of different areas because there are a number, as we said, there are a number of businesses that need to remain open, and construction sites can stay open. Well, we have to be there. There are so many reasons for us to be open, and we want to continue government. We can't just send everybody home and close local government. So it's a 1 day to 1 day for the next 10 days. So each employee will work 1 day and then not the next, and then they'll work the next day. That is cutting the staff in half. That cuts down on the number of the likelihood that someone would be exposed. But all staff has been trained. I'm not a physician. I'm not a scientist. but it appears from everything that I see, and this is my own opinion, that this is getting passed from human being to human being, from people coughing and sneezing and being too close to each other. We are constantly asking all city departments if they have all the right cleaning supplies. If somebody's too close to somebody and they're working, we'll find another place for them to work. All our phones are transferable. We can forward our calls to our cell phones, to another phone, to another part of the building. We can move desks. That's not an issue at all, but we're here to serve the public. We want to do it so it's safe for our employees and also a good way to help to service the public. And we get phone calls after phone calls about where to get food. What happens if I can't pay my rent? We get calls from businesses, and we want to be fully staffed to answer those questions. Real quick, I know this is repeated over and over and over again. This is a disease and a virus that does not like soap, and it doesn't like alcohol. Just remember those two things. Remember that treat yourself as you're exposed, treat everybody like they're exposed, and treat every surface as though it might have been compromised, although it doesn't appear that, that people are getting the virus and transferring it because they touched a paper bag or a piece of paper or a book or a CD case. But again, I'm not the medical expert here, but I'm just sharing with you the information that I see on, from CDC that was collected not only around the country, but in other countries. The biggest thing is, if you're an employee anywhere and you're not feeling well, stay home. Get on the phone with your physician or Health Stop or whoever it is that you need to call in the healthcare industry, and make sure they understand what's going on in your particular life. Here's some of the partnerships that we have. And thanks for donating. Here's a list of everybody who has made donations, and there are just so many. But these are the businesses that and the individuals that have made donations in terms of supplies for our public safety and people in the medical world and the healthcare world. And we want to thank every single one of them for what they've done. The library is not open, but again, they have Wi-Fi drive-in capabilities. If you want to pull into the rear of the building, take a little picture of that. I'll leave it up for a minute. In the meantime, if you are new at going to the library's website and you've never downloaded music or a book or taken advantage of some of the resources that are there, and you run into a problem and you'd like more information, you could call daily, call the library, and somebody will walk you through the process in terms of how to download things. And it's just so much available to us. It's an endless supply of things that are available to us via the internet now and different websites. And there's a lot there, and if you are stumbling through and having a difficult time, call the public library. Senior shopping hours, so today is gone Tuesday, but Wednesday and Thursday, 5:30 to 7 a.m. at Market Basket. Shaw's Tuesday and Thursday from 7 to 9. Target first hour shopping Wednesdays at 9. Walmart 1 hour on Tuesdays before they open, so call to find out what their hours are or go to their website. Hannaford 6 to 7 on Tuesdays, Wednesdays, and Thursdays. And that gives you sort of an outlet on that. I really think a couple of things, and I'll have a discussion with the health department tomorrow, is gas stations. I've been to a number of the gas stations today. You're constantly touching things, and while I say that you may not be able to transfer it from that touch, it doesn't mean that we can't minimize one's exposure. And gas stations, you cannot just pull up. There are no gloves. In almost every situation I saw today, there are no gloves, there is no hand sanitizer, and the gas stations are staying open. They're a public service. They do, I don't know, there's a couple that will pump gas for you, but I'm going to have the health director make contact with those gas stations tomorrow. The other thing is it would really be nice if somehow or another the supermarkets would offer that service where they would deliver to the elderly. That would really help. So maybe you have a parent that lives here, but you don't live here. You live in another state, or you live in another part of the state. You could get online, put in an order for your parents, and it would be delivered. That would really go the extra distance for elderly. And I know they're doing 60 plus at supermarkets, so the elderly can go in from 5:30 to 7:30 in the morning. But we're really trying to tell the elderly to stay home and hunker down until this is through, because they're the most susceptible and most at risk. There we go. Takeout food. I know you can't eat out every night. It gets a little expensive, but a lot of the businesses try to offer specials and make it affordable for you and your families. And it would really help them at a time when it's really uncertain as to how long this will go on. And anything you can do will be helpful. And share it. Get on social media, tell your friends, Skype, whatever it is, and tell them the experience that you had. Leominster parks are open. We have not closed them. They are open. The playground equipment, all closed. The exercise equipment at Doyle Field closed. But I will tell you and give you a little bit of a sneak peek. Last week they stocked Barrett Pond with 500 rainbow trout. So there are people there fishing and walking around. Again, keep your distance. Keep a set of gloves with you. If you're walking by somebody on a trail and it gets a little tight, step aside. Let them walk past you so you keep your distance, and then resume your walk. Volunteers, can we use them? Yes. Can we use them right now, like right this second? Not always. But we're keeping a good list. We're keeping a very good list available, and should the need come, we will call you in to help us out. So in the meantime, if you need help, let us know. And if you'd like to volunteer, let us know. And you can call that number at the emergency management. This is a really good opportunity to stop or call or go to the website for the emergency management and find out what they do. They have a great organization, a lot of volunteers. We have so many different areas of emergency management. Well, we have our emergency management center being operated and staffed as we speak. And thanks to most of them are volunteers, but they are trained, they're experienced, they come from every walk of life. They bring all kinds of talent to us. And as we speak, they're staging a dispatch center there. They're also the backup for a dispatch area in case police and fire department goes down. So 978-534-7500, 5055. We continue with projects here in the city of Leominster. There are a number of things that have deadlines. They have not extended out those deadlines. There are a number of grants that have to be fulfilled by June. And so anyway, projects in the city continue, and yes, City Hall is open. We're half-staffed in every department, but we are there. We will get you service. A number of employees will be forward. The days that they're not physically at City Hall will forward phone calls from their phone and extension to their cell phones, and they also have the capabilities. Every city employee has the ability to forward their calls. Every city employee has the ability to check their emails from anywhere electronically. Again, as I said, if you've been through the photo albums and you've been through the 8mm reels of weddings from the 60s and 70s, and you've run out of things to do, and that U.S. Census 2020 is staring you in the eye, and you just keep moving it around from pile to pile, hoping you can hide it and forget about it, fill it out, send it in. Right now, the version you have is electronic, so send it in. And that's the last time you'll hear from anybody. If you don't fill it, if you don't do it electronically, you'll get the old-fashioned form. If you don't fill that out, then the persistence begins in terms of trying to identify all those who are out there that haven't filled it out. So please, get it over with, fill it out, you'll feel really good about it. Again, we want to thank you for watching. We want to explain to you that we're not in a complete sort of lockdown scenario, shelter in place, and we won't have to get to that point if we would just use common sense and follow those simple rules, proper hygiene, proper distance, all of that, and that will minimize it. And when we share it to somebody who shares it to somebody, and you could share it to 2 and 3 people, but the average person they have found shares it with 2.5 people, who then shares it with 2.5 people, and you can see where this all goes, and you can see where New York and other places have gotten themselves in trouble. We want to close by thanking you and everybody who's helped anybody, made donations, done grocery shopping, made a phone call so somebody's not lonely sitting there by themselves, brought a book over, those that have to work that are our essential employees, those in the supermarkets, in the food industry, in the fast food industry, in the takeout business, and those in particular in the healthcare business, nurses and doctors, and the backup system, those people that clean the hospital, the people that cook and do all that backup support systems for those in the medical world, as well as those in law enforcement in the medical world, the fire department, the police departments, our EMS employees, first responders, and those at emergency management. We want to thank them. It's uncharted territory. They are our first line of offense and defense. It's scary for them because they don't always know what they're dealing with. And that's why when we close today, if you do have to call 911 for any reason, please tell the dispatcher on the other end what might be going on in your life so that they fully understand what they're preparing themselves for as they head to your house with an ambulance or a police cruiser. They'll ask you a series of questions, the dispatchers will, and that will help. So thank you all. We will not do the 9 o'clock briefing tomorrow. We may do it just from my office, and we'll do that through Facebook, but we will be back here at 4 o'clock. If anything, and the numbers increase tomorrow morning in terms of how it affects us locally, and there's more test positives, then we'll let you know that at 9. So 9 will be sort of a short version, and then we'll do the more extended one at 4 tomorrow afternoon unless something else comes up. In the meantime, there are 2 test positives here in the city of Leominster. Testing is at its all-time high. We expect that to increase daily. The supplies are coming in. The turnaround time for getting the results is higher. And so a whole lot going on. There are a number of medicines that seem to be responding to those who are really critically ill, and it seems to be responding. Again, I'm not a physician, and I'm not in the healthcare industry. I'm not an expert. I'm not anything. But I do stay up on what's happening, and it appears at some point we'll get a small test that you get, and you just a little prick of your finger, get a sample of blood, and down the road, not today, but down the road, they'll be able to tell you whether or not you've actually had the virus. There are many people that have already had the virus and didn't know they had it. So we'll close that out. My name is Dean Mazzarella, Mayor for the City of Leominster. I want to thank everybody here at Leominster.tv and also WLPZ 95.1 and then streaming at WLPZ.org. So thank you all. Take care of yourself. Assume you have the virus. Assume everybody you come in contact with has the virus. And assume everything you touch has been compromised. Stay clear of everyone. Keep your distance. Wash your hands. And remember, this virus despises soap and alcohol. Thank you. Be safe. Be well.